What is thyroid disease? Thyroid disease is any condition that affects the functioning of the thyroid gland, a small butterfly-shaped organ in front of the neck that secretes hormones. In the U.S., thyroid disease affects 1 in 10 Americans. Symptoms of thyroid disease will depend on the exact condition you have. The most common thyroid diseases are hyperthyroidism, overactive thyroid, and hypothyroidism, underactive thyroid. These conditions occur when your body makes too much or too little thyroid hormone, respectively. Fortunately, there are a variety of treatments you can use if you receive a diagnosis of thyroid disease. Your treatment plan will depend on the type of thyroid disease you have, your symptoms, and your overall health. Generally, the most common treatments include medication and lifestyle changes, and in some cases, surgical procedures. There are several types of thyroid disease, which include hyperthyroidism, an overactive thyroid that occurs as a result of your body producing too much thyroid hormone. Hypothyroidism, an underactive thyroid that can happen when your body isn't able to create enough thyroid hormone. Thyroid nodules, lumps that are either solid or filled with fluid that grow in your thyroid. Goiter, an enlarged thyroid. Thyroiditis, swelling or inflammation of your thyroid gland. Thyroid cancer, growth of cancer cells in your thyroid. Symptoms: the most common thyroid diseases are hyperthyroidism, hypothyroidism, and thyroid nodules. Symptoms of thyroid disease depend largely on the type of condition that you have. Since thyroid hormones are vital to your body's metabolism and function, you may also experience symptoms that affect several body parts. Generally, hyperthyroidism and hypothyroidism cause very different symptoms. If you receive a diagnosis for either of these conditions, you may experience one or more of the following symptoms. Symptoms of thyroid nodules look a bit different. If your nodules are small, you might not experience any symptoms at all. However, larger nodules may cause 6 a noticeable mass or swelling in the neck fullness or discomfort, voice, difficulty swallowing, difficulty breathing.
Causes hyperthyroidism and hypothyroidism occur when you produce too much or too little thyroid, respectively. Why a change happens in your hormone levels can depend on a variety of factors, such as inflammation of the thyroid, damage to the thyroid gland caused by radiation, autoimmune conditions such as Hashimoto's disease or Graves' disease, hormonal changes during pregnancy and postpartum, being born with a congenital thyroid disorder. Risk factors aside from biological processes that can alter your thyroid hormone levels, a variety of environmental risk factors and being assigned female at birth, being over the age of 60 years old, having thyroid surgery, exposure to radiation or getting an accurate thyroid disease diagnosis is critical in order to receive treatment that can help you better manage your condition. At your appointment, it's standard practice for your provider to ask you about your personal and your family's medical history. They will likely also perform a physical exam and check your neck for any signs of inflammation, tenderness, or apparent. In some cases, your provider may also choose to take a look at your facial features, hair, and skin for any hyperthyroidism or if your provider thinks you may be at risk for thyroid disease or notices symptoms of a thyroid condition, they can also order additional. These testing methods may include thyroid function tests that check your levels of various thyroid hormones including thyroid, additional blood tests that check for thyroid-related antibodies that your body may be producing to fight harmful cells in your imaging tests such as an ultrasound, thyroid nuclear scan, radioactive iodine uptake test, computed tomography CT scan, and Thyroid biopsy only if you have nodules or lumps, which takes a fluid or tissue sample off nodules in your thyroid gland.